You mentioned that you're 38 weeks and you're having a hard time. You've had issues with asthma and you feel like your lungs are just getting squished and you can't breathe. And it sounds like you're just ready to be done. And at this point in pregnancy, moms are ready to be done. But babies aren't always ready to come yet. You are the best incubator by far for your baby, and studies have shown that babies born after 39 weeks do best. You mentioned that you've talked with your doctor about the different complications and concerns you've had, including high blood pressure, and they've told you that it's okay to wait until you're 40 weeks unless something changes between now and then to be induced. And here's some things to understand about induction. Number one, especially if this is your first baby, it's not really a good idea to induce someone for fun. Sometimes elective inductions is what they're called, are presented as an option for women who have already had babies before, because if their cervix is primed and ready to go and like they've dilated a little bit and it's softened and moved forward in their pelvis and begun to thin out, then their body will respond well if we start an IV and give them Pitocin. Their chances of C-section aren't as high, and things usually go nicely because their body's had a baby before, and as soon as it starts contracting, it's like, oh, I remember this, and things usually go well. However, on your first baby, your body is really stubborn, and we don't like to induce people who don't have to be induced unless it's for a medical reason, because your body is so stubborn and resists the things that we do in many cases, and your chance of a C-section is much higher. So I'm guessing this is why your doctor has some hesitancies in inducing you. Of course, there are medical reasons why it needs to happen sooner. If your blood pressure were to go up really high and your blood work came back abnormal and the doctor felt at that point, putting all the pieces of the puzzle together, that you should be done for a medical reason, that's an entirely different story, because at that point, whether you have a C-section or a vaginal delivery, you need to be done. But I'm sure your doctor just doesn't want to increase your risk of C-section just for the fun of it. So I suggest calling your doctor in the office and be candid about your concerns and your questions, and they can give you the best information based on their knowledge of your entire circumstances. And if your doctor is recommending that you wait to have your baby, then listen to them, because they're giving you good advice. As long as you're doing well, then it's better for your baby if you can stay pregnant for just a little bit longer. I hope the very best for you, and congratulations ahead of time on the birth of your baby. And if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.